So the Better Regulation Agenda regulates how policymaking is carried out at the European level. One of the pillars of the agenda is stakeholder participation in policymaking, which contributes to the agenda's goal of ensuring that policies are supported by evidence. So civil society organizations are participating in policymaking through this framework by taking part in different avenues of consultation where they can bring their expertise, but also the voice of citizens, patients, and the communities they represent in the inputs that they provide on the proposed legislation. This contributes to strengthening the democratic process and its legitimacy. So the consultation exercises include, for instance, taking part in calls for evidence ahead of the preparation of a proposal, providing feedback on the proposed legislation, or feedback on existing laws. The formats include surveys such as open public consultations, conferences, workshops, or other events or meetings with policymakers. And so as part of the Better Regulation for Better Health project, we carried out a survey that showed that civil society found in-person meetings the most meaningful way to provide feedback, while surveys were seen as elements that were at risk of becoming solely box-ticking exercises. We've also identified that civil society organizations are facing difficulties in carrying out their role with three key challenges. There is what is called the shrinking civic space, which means that organizations are facing barriers in implementing their activities, but also in some cases smear campaigns and threats. Then they're also facing difficulties accessing sustainable and reliable means of funding. And finally, there is the challenge of competition from actors that defend commercial interests, including from health harming industries that have more resources to take part in policymaking processes and engage in lobbying, which result in an imbalance of representation. And so these 3 points are relevant regarding the capacity of civil society organizations to take part as planned and as required in the consultation processes foreseen within the Better Regulation Agenda, as it hinders their participation and therefore their inputs provided in the process. It can prevent them from dedicating the time needed to engage critically with health policy initiatives, as well as within the broader agenda itself and its narrative. So therefore, we're advocating for a strengthened civic space, focusing as well on strengthening the capacity of health civil society organizations to advocate on improving the Better Regulation Agenda and make it a program that supports stronger health policies. And as part of the project, we have identified recommendations on how the consultation processes could be improved with enhanced user-friendliness or transparency on how the feedback is used to increase the meaning of the consultation process and support the participation of civil society organizations.